Knock, knock.
Yes.
Hi, good morning. My name is Amy. I'm going to be your nurse for today. And verify your name and date of birth for me, please.
Michelle Bishop, 9588.
All right, good. I'm just going to do a little hand hygiene and provide us with some privacy. Your doctor has ordered a head-to-toe assessment for today. Is that okay?
Yes.
All right, what we're going to do is start with your head. I'm going to note that everything is symmetrical. Your ears line up with your eyes. They're not too small, not too enlarged. Are you experiencing any headaches?
No.
Any ringing in your ears?
No.
Any runny nose?
No.
Sore throat, cough?
No.
Okay, so next we're going to move on to your eyes. What I'm going to do is I'm going to measure your pupils, and they are a 4. So what we're going to do is I'm going to shine a light into your eye. I'm going to watch for the pupil to react as well as the other one, okay?
Okay.
Alright, and on the other side. Alright, so your pupils are round, equal, responsive, and so now they react to light. So now what we're going to do is the accommodation of our PERLA acronym, okay? So what I want you to do is keep your eyes focused here. We're going to move it in and then move it out, okay? Alright, and your pupils did accommodate. While we're here, go ahead and lean back for me and look to the left. I'm going to note that there's no jugular vein distension. Go ahead and turn that way for me, and note it on this side. And you did say you weren't having any sore throats, correct?
Correct.
Okay, so just going to palpate the lymph nodes. Perfect. All right. Okay, so you told me who you were. Do you know where you are?
Yes.
Where are you?
And Bon Air, Georgia.
All right. Do you know what year it is?
2021.
Okay, and what are you doing here in Bon Air?
Helping make some videos.
All right, so that confirms our neurological assessment of it, okay? So you are oriented ×4, which is what we would chart. You know who you are, where you're at, the year it is, and the situation that you're in, okay? Oh, I stepped on them. All right, so if you were not conscious, what we would do is part of our Glasgow Coma Scale. It assesses for your motor function, your verbal, and your eye response, okay? Are you experiencing any dizziness at all? No? Okay. And now we're going to move on to your respiratory. Okay, I'll go back. Alright, so I'm going to listen to your lung sounds, and I'm going to start in the right upper quadrant. If you'll just take a deep breath in and out. And the left upper quadrant, in, out. Right medial quadrant. Left lower lung. Your right lateral lung. Lower lung. And your left lower lung. Alright, go ahead and lean forward for me. And your right upper lung. Breathe in and out. In and out. And that was your left upper lung. Now your left lower lung. In and out. In and out. And we ended with your right lower lung. I did not hear any wheezing, any crackles, or anything like that. Are you experiencing any shortness of breath?
No.
Okay, and right now with COVID going on, we encourage deep breathing and coughing about every commercial break, since you're sitting here watching TV, okay? Maybe 2 times every commercial break. I just want you to breathe in and let it out, and then turn and cough if you'll demonstrate for me. All right, perfect. And this here is our incentive spirometer that I want you to use. This here, you'll take a deep breath in. The ball will go up to our target point, which is 4. What I want you to do is hold it for about 5 to 10 seconds. The longer the better. You hold it, it helps expand your lungs. If you could demonstrate that for me, please. I want you to suck in, please. There you go. Hold it and then let it out.
Oh, that worked much better.
Perfect. How often are you going to do this for me?
10 times.
In an hour? Or
Yes.
twice every commercial break. Just don't do it 10 times in a row, okay? Perfect. I'm going to set it here beside your call light for you, okay? Okay, I also note that you don't have a cough, so there's no sputum to assess. Now I'm going to move on to the cardiac portion. So what I'm going to do is I'm going to palpate your radial pulses. Perfect, you're at a 2+, which is what I expected to find. It's easy to palpate, okay? If we needed to find a pulse anywhere else, you have one in your brachial, your axillary, which is your armpit, your carotid here. You have one in your femoral, which is kind of your crease here, behind your knee, which is popliteal, the dorsalis pedis on top of the foot, and the posterior tibial kind of right behind your ankle bone, okay? Now I'm going to listen to your heart. Are you having any chest pain today?
No.
Okay. So now I'm on the right side and listen to the aortic. Move over to the pulmonic. Down to Erb's point. Down to the tricuspid. And then mitral. Alright, we have the normal lub dub that I hear. If I heard anything suspicious, I would flip my stethoscope over and listen to the bell for any low pitches, like search for a heart murmur, okay? Okay, so now you'll just give me your hand. I'm going to test for capillary refill within 2 to 3 seconds. 2 to 3 seconds, and while I'm over here, I'm going to check for any edema, okay? Alright, no edema noted on the right. No edema noted on the left. We'll move down to your legs here. No edema there. No edema there. Down here, I'm going to check for your dorsalis pedal pulse. And your posterior tibial. Dorsalis pedis. And posterior tibial. Alright. They are easy to palpate. This is a 2+. All right. And you said you weren't having any chest pain today, correct?
Correct.
All right. While we're here, we're going to do range of motion, musculoskeletal. That way, when we do the abdominal, we'll have it down, okay? So I'm going to check your elbow. And what I want you to do is flex and then extend. There you go. One more time. All right. I did not feel any crepitus. What I want you to do is flex against my hand, okay? And then extend. Perfect. Okay. Flex, extend, flex, extend, perfect. Flex, extend. All right, no crepitus noted there. Is that painful at all?
A little in this joint
Little
when
in
the
that
weather's bad.
Okay, all right. So what now we're gonna do is your wrist. What I want you to do is flex, extend, there you go. Do it one more time. All right, any pain there?
No.
No? Okay. I want you to press against my hand. There we go. And flex against. Perfect. Okay. We're going to assess this one. So I want you to hyperextend, extend, flex. Perfect. Do it one more time for me. Any pain there? All right. Press against my hand and press against. Perfect. All right. So we're going to move down to your knees. What I want you to do is to flex and then extend. So I want you to bring your leg back and then straighten your leg out for me, okay?
Okay.
I'm gonna put my hand on your knee here. Here you go. Go ahead. Flex and then extend. Flex and then extend. I do feel a little bit of popping. Is that normal?
Yes.
Okay, all right. So go ahead and push against my hand. All right, and push against my hand this way. Perfect. While I'm over here, we'll go ahead and do your ankle, okay? So I want you to dorsiflex. There you go. And plantar flex. One more time. Perfect. Okay, push against my hand and push against my hand. Perfect. Any pain there? No. Okay. And on the right side, go ahead and flex your knee and straighten it out for me. There you go. Go ahead and flex and straighten out. I feel popping that one too. Is that normal?
I've had surgery in that.
Surgery in that knee. Okay, go ahead and press against my hand and press against my hand. Is that painful at all?
No.
Okay. Go ahead and bring your toes up to me. There you go. And point them down. Bring your toes up and point them down. Any pain? All right, go ahead and press against and press against. All right. And do you exercise on a daily basis?
I do.
Perfect. All right. Before I have you lay down, will you go ahead and stand up for me? We're going to assess your walk, okay? If you would just take a couple steps for me and then turn around and walk back to your chair. You have a smooth stride. Go ahead and stand up. Stay standing up. Now we're going to assess your balance, called the Romberg's test. If you'll put your feet together and your hands by your side, go ahead and close your eyes. I'm going to check for any swaying for about 20 seconds. And none is noted. If you would go ahead and have a seat and lie down for me.
Can you take my Xanax spirometer?
I sure can, so you can lay down, no
Thank
problem.
you.
All right, are you having any cramping today?
No.
No. All right.
Okay.
Okay. All right, so I'm gonna first notice, I'm gonna check your abdomen for any distension. It is flat, and there is a scar here on the right side, which I will note. I can see you have two.
Yes.
And one up here, okay? So now I'm going to listen to the quadrants of your belly. I'm going to start in your right lower quadrant, which is where active bowel sounds begin. Listen for a minute. Move up to the right upper quadrant. And the left upper quadrant. And the right lower quadrant. Okay, and you have active bowel sounds. Alright, so I'm going to flip my bell over and listen for any bruit in each quadrant, starting with the right lower, right upper, left upper, and left lower. And there are none noted. Okay. You can go ahead and, there you go. And now we're just going to do a light palpate, okay, in the right lower quadrant. Is that any discomfort? Okay, I don't feel any nodules. Any discomfort? Anything here? Here? All right, I'm going to press a little harder. Okay. No pain. All right, you go ahead and sit up. Okay. All right, so I did hear normal clicks and gurgles. Your belly is inverted, and I did say that you did have two scars on the right lower quadrant and the right upper quadrant. And what are those from?
I had an adrenalectomy.
Adrenalectomy, that's interesting. Okay. I did not feel any knots or nodules. When was your last bowel movement, Miss Michelle?
Last night.
Last night. Are you having regular flatulence?
Mm-hmm.
Perfect. All right. Are you having any urgency to use the restroom and you just can't?
No.
Is everything is good there? All right, so what I'm going to do is perform some hand hygiene. I'm going to document our findings, and the doctor will be in just a minute, okay?
Okay.